Agoraphobia and panic disorder are two completely different conditions that are connected because of their anxiety that comes from both of them. Agoraphobia is the fear of not being able to escape. People often fear certain situations that they get caught in, such as being stuck in a crowded mall or being caught on a bridge where they can't find an easy means of escape, and they begin to panic. It was previously thought of as the fear of open spaces, but that has changed. People sometimes become so scared of situations that they become housebound because they're scared of going other places and not being able to escape. So they have parents and family members or friends that will do things for them, like go get groceries and run other errands because they're too afraid to leave their own home. According to Behavioral Health Advisor, people often develop this in their late teens to mid-30s. They also state that women are more likely to develop agoraphobia than men. About.com states that 1/3 of people will develop agoraphobia in their lifetime. Panic disorder is a condition that develops after one or more panic attacks. There is often no warning for a panic attack, and it's often just like agoraphobia is from certain situations because they begin to feel overwhelmed and start to panic. It often peaks within 10 minutes and lasts about 20 to 30 minutes. It rarely lasts more than an hour. The first panic attack often leads to the disorder, and agoraphobia is thought of as the result, because if you were stuck in a mall and you begin to panic, then you'll want to not go back to the mall again because you fear having a panic attack again. Mayo Clinic states some of the symptoms that happen with both agoraphobia and panic disorder, and they include upset stomach, increased heart rate, dizziness, excessive sweating. Some of the causes are that they tend to run in families, but there's actually no known cause for either of the disorders. They can also be triggered by major life changes such as moving or a divorce. They can cause life problems because people don't like to move to other places and they fear going out. So it can affect your job because if your job requires traveling, you don't want to go to that place and you can lose your job because of it. That also involves avoiding certain places, such as the mall example, where people don't want to go to the mall anymore because they fear that they'll have another panic attack. This can also lead to depression, drugs and alcohol problems, loneliness and isolation, and that's according to Mayo Clinic. Cognitive behavioral is one example of therapy, and that's learning to change your response to your reactions to the situations that you're scared of being in. Relaxation involves yoga and meditation. Relaxation helps a lot because it teaches you how to relax in your situations and so that you can prevent panic attacks in the future. Visual imagery involves imagining what you're afraid of and imagining the situations you're scared of being in and changing that response. Exposure is like that too, where you're in a safe environment with your therapist and they teach you how to react to situations that you're scared of being in. This is an example of a chart that people with agoraphobia and panic disorder can use, and they can fill out what the situation was and how they can change it, and their therapist helps them. That's according to the Anxiety Disorders Association of America. Psychotherapy is the medication with therapy, and it often results as the best help for patients. Often people, for their medication, they use Prozac or Xanax or other antidepressants. It is thought of as, kava is thought of as an herbal substance that helps anxiety, but it is proven to have liver problems. And the Food and Drug Administration hasn't changed the sale in the United States, but they have in other countries, and that's according to Mayo Clinic. In conclusion, therapy is the best result to change agoraphobia and panic disorder. And relaxation and psychotherapy will help you control your anxiety and help you so that it doesn't control your life.